Okay, here is what I have to say about something. Darn it. I ate that cookie and I got the sugar buildup in the back of my throat. My nose wants to run. Damn. Oh, oops. There goes another $100. Okay. So anyways, in 2001, I had healthcare coverage with Cigna. Okay. So anyways, and with them, I was told I only had to do the copays, right? Well, today I went to a doctor I hadn't seen in years, and that's how long it's been, 11 years. So I was like, hey, she told me that I had a bill. After the fact, they had me in the back in the office. I'm like, she was like, you have a bill for $285. I'm like, really? First of all, my payments for, I guess you want to call it membership for Cigna was coming out of my pay one way or another. Anyways, I get the bill for, let's see, yeah, I get the bill for it now in 2012, which says the insurance denied it. So I'm stuck with the bill for $285. And I'm like, okay, then what's the use of me having an insurance card if I'm going to get billed that had to pay the copay when I could just not even bother signing up with my company's insurance and just pay the doctor out of my pocket? Because it wasn't like he gave me a discount or anything. And it's just very strange how they say they have insurance, but if you're paying for that membership out of your employee's paycheck, well, not out of your employee's paycheck, but if you're the employee and you're paying it directly out of your check, so you don't even see that money a month because you signed it over and they've got an allotment going to them, or they have some type of direct deposit going straight to them like a bill pay, but you have a sort of like a mini accountant office or an accountant office or accountant who is actually redirecting your money out of your pay from your banking facility or finance office to that other set of people, then your membership should have explained that, but they didn't. And this was just nothing more than a woman's health appointment. Seriously. $285? I'm like, I gotta pay that? Then where's the real savings on that? There is none. So anyway, the inspiration for today, because of that or due to that, made me think, how can I change this situation? So, one, during that time period, I was working for one or two places. It was either Pulau or RS Communications. Pulau, I was making $12 and something an hour. RS Communications, I was only making $11 an hour. So yeah, really, that wasn't covering it. Wasn't covering it at all. But I do know it wasn't Pulau's insurance because I had Aflac with them. So I'm believing it was RS Communications insurance. So anyways, my PCP, which is my primary care provider, Charlotte, didn't contact me to let me know that, but we're not going to get into all of that anymore. The inspiration from that is because that insurance stuff really confuses me. You're supposed to have it backed up. So I typed up today, you know how they have the FDIC, federally insured stuff for the banks? I said, okay, fine. NACN, federal government agency, www.ccr.gov. And I put up my phone numbers up there. Okay, we have the H period L period D period N or VN period VI period O period S period federally insured. How is this? It'll be health, labs, dental, vision, vehicle, operations, and surgery. Okay. Now, I didn't put the A and the H in there, but that should be included in there too, which would be apartment and homes. Anyways, I gave the examples for them because that's how it would need to go anyways. So I'm getting ready to read the rest of this. So anyways, it goes health, lab, dental, vision, vehicle, operation, and surgery. Federally insured. For example, period, if you have 800,000, 800, oh damn, I spelled it out and I left out 3 zeros. I know somebody's like, she's so backwards. They're like, oh no, she left out 3 zeros. Okay, so anyways, $800 million worth of payroll going out to employees. You must be HLDVNVIOS, which means when making a business plan / deal, you have to double the amount and place into a savings account, a save account. I said save instead of savings account because it really is saving you. Saving you the trouble of having to go through a lot of hassle. So, okay, a save account with accrued and acquired interest rates of 0.24% to ensure /ensure that the insurance companies and personal, family, and company plans work properly and smoothly together. That's the first example. The second example is this. For example, if someone were to buy a brand new, quote, brand new $53,000 off the lot SUV Infinity truck for $15,000 down and had a balance of $38,000 left to pay on it, the insurance company would have to pay the balance of the $38,000 to the dealer or lien holder, plus have to pay for the same exact year, make, and model at the pricing when purchased to replace the vehicle damaged. Ta-da! Okay, the same with the same follows it. Boy, I did not edit this at all. Let me start over with that sentence. The same with the same follows for apartment, house, home, mansion, palace, insurance. Okay, so what I'm explaining here is that one, I didn't edit it, and two, the same, those two words, the same, shouldn't have been in there because it's 2 sets of those. Okay. Okay. The estimate of the insurance adjuster / consultant plus due to the inflation of pricing of items and repairs and additional $20,000 to $100,000 inflation must be added to the insurance recipient for repair and damages to personal property such as clothing, furniture, stuff like that. I didn't get too into detail. I got distracted or something like that. I think when the kids started talking to me. So anyways, I just stopped right there because I didn't even put etc. on there. We know what we're talking about as far as the clothing goes, the furniture goes. Besides that, I have to re-edit that anyways. But I just wanted them to have an idea so that way they could type it up. I gave them some examples. And I hate being so sloppy in my work. But it gives somebody else a chance to go, what the heck is she doing? But at the same time, there you go. There are your answers to be able to have a better life. So if it was a house, if it was a car, if it was like this one woman I know, her the wiring in her house caused the electrical fire in her house, and when it did, it messed up her entire living room. I want to say parts of her living room and I think parts of her bedroom. I believe that's how that went. Either way it goes. So her living room ended up having vaulted ceilings afterwards. And she redecorated that house so nicely. Like, they actually carved in the walls to be able to put places where you have artwork in them. So what they did was they made like impressions in the wall, is what I would say. So I don't remember, I think she had lighting above it or underneath it, so that way it actually shined on the artwork, whether it was like a vase or something like that. But those are things to think about when redoing your house and stuff like that, especially when there's damage occurred. But that being said, with the health insurance too, if they're going to work for you or if they're not going to work for you, regardless if they're like on Social Security or things like that, they still need the money enough to be able to pay those bills and still live comfortably, to feed themselves, put gas in their vehicles, and get around to somewhat be sociable, so that way if they're still healing while they're going through their process, they can have their blood circulating around instead of just sitting and not doing anything. That gives them something to do. They'll be more mobile to get around. And that's what we need, right? So, hey, let's get it together. Let's see what your good works are about. Have a nice day.